Hey everybody, this is Dr. Michael Scherer. I wanted to go ahead and talk about a case that I saw recently in my clinical practice on a follow-up of a surgical case that I did not that long ago. Patient was a dentulous, missing all their teeth. Wearing an interim complete denture, was reasonably good. Patient says to me, Doc, I really can't deal with this loose floppy denture anymore. Is there something that you could do to help me? And I immediately thought about Zest ENCOMPASS. The all-in-one overdenture solution is from Zest, kind of a pretty cool concept of basically taking a box that has everything that I would need in it. A surgical guide and surgical plan, a 3D printed definitive prosthesis from Absolute Forever Denture, the dental implants from the LOCATOR Overdenture Implant System, and parts and pieces that I would need to go ahead and convert the denture at the day of implant placement. I worked up the case, did a little impression, did a cone beam, saw the patient back, and I had a surgical guide, numb the patient, pop the guide on, pilot guide, drilled the initial holes, put in 5 LODI dental implants, all in the anterior mandible and posterior mandible as well. Instantly, I was like, wow, there's something really here to this. This is pretty interesting, pretty cool. I was able to put in some larger diameter implants in the posterior and narrower diameter implants in the anterior. Thought it was kind of neat. I'm like, wow, those implants went in really well, especially those posteriors with those aggressive thread patterns on the larger or the expanded range diameter LOCATOR Overdenture implants. Implants all torqued in above 30 to 35 Newton centimeters. I had a 3D printed Absolute Forever Denture sitting there going, hey, you want to go ahead and use me for immediate load? I'm like, absolutely. It was kind of cool because I already had the holes inside of the denture. So I didn't have to go in there with my bite registration material, enlarge the holes, and then all of a sudden, like, I got a massive hole here and here. I literally took the denture, popped the housings onto my LOCATOR abutments, and seated the denture, and it fit passively from the get-go. I was like, wow, this is incredible. So I did a pickup of the housings and sent the patient home with an immediate load overdenture prosthesis. Saw the patient back about 2-3 months later, which I just saw recently, and he came in first time, made an x-ray pano, implants look fantastic. Patient looks at me and he says, Doc, this is literally the best thing I ever did. I can't believe that you can do all of this with this digital system. You know, and I said, well, there's really not much to it. I just make a scan, send it off to a laboratory, and I collaborate with the laboratory, but it's teamwork. Wanting to go ahead and we get our dental implants in place, working with our surgical workup team, and then also making sure that we can go ahead and have this incredible prosthesis ready for you at the time of implant placement. Patient's like, oh my God, can I tell more people about it? I said, absolutely, tell all of your friends, and all of a sudden, I've got patients now calling me up saying, can I get that same thing? Just wanted to come to you all and just show you a couple of these cases of follow-up because it was a really cool thing to see this in my clinical practice, but it's a big part of how I grow my implant overdenture practice. We'll see you next time.